Hi, today I want to talk a bit about hip pain. So I get people, I would say an average of one a day that has hip pain, sometimes two or three in a day. Hip pain is really common, so it's important to talk about it a little bit because people put up with that pain and some people live with that pain for months or even years. And they've been told or they think they have maybe arthritis or dysplasia or a worn joint or worn cartilage or tendinitis or bursitis or a pinched nerve or degenerated joint or disc problems. And they probably have an image or some kind of medical image to show it. And they probably have that, but that almost never has anything to do with their hip pain. The hip pain comes from tight muscles in the hip muscles, which are mostly the gluteus muscles. One of the most common diagnoses that people come in with is that they say they have sciatica. Because that hip pain goes all the way down and goes down to the leg, and that's where the sciatic nerve goes. And so if they've been if they've been somewhere with that problem, the first thing they usually tell them is to get an image of your spinal column. And of course, if someone sees that image, you'll find some kind of anomaly because anybody over 40 years old is going to have some kind of thing that's their spinal column is not perfect. So that's the problem. It never is. Almost never. I could say maybe in 25 years I've had 5 people that really had some problem that really need to have surgery. A lot of people, or maybe 40% of them that come in, I've already been scheduled for surgery, and they never need surgery because this is a muscle problem. There's a way to check, an easy way to check with palpation, but it doesn't seem like it's ever done. And you can try it at home. Have somebody, maybe it's better to have somebody else come in like with their elbow in your lower back, and where supposedly it's coming from. And see if that reproduces the pain. It doesn't. But if you go into your hip, on the side of the hip, close to maybe up toward the rim and down toward the joint, you go in there and ring, you'll feel that pain all the way down. That's where the pain is coming. It's coming from the muscle. Great news because the muscle responds rapidly to this therapy. And people that have had this problem for years, one therapy often, sometimes 2 therapies, and it's gone forever. So it's just important. The important thing to know is that if you've been told that it's in your back, it's in your spinal column, it isn't. I just want to give you that information, and that it's very easily eliminated. The thing is that one has to know how to do it. And one of the keys is to get in deep enough to be able to loosen those muscles that are really deep in, and knowing how to go deep enough so that it feels great and it feels like it's relieving the whole way, not that it's hurting. Because if it hurts, your muscles tighten, and you don't want the muscles to tighten. So just wanted to let you know that please don't go for surgery for sciatica or hip problems. Well, if you've had an accident or something traumatic, that might be the case. But for chronic pain, you never need surgery. Thank you.